The examination of the nervous system consists of 4 components: the examination of the higher cerebral functions, examination of cranial nerves, examination of the upper limbs, and examination of the lower limbs. In this segment, we will introduce to you the techniques of examination of the cranial nerves. The examination of the olfactory nerve is not routinely done during the neurological examination. However, if the patient has anosmia or if the patient has signs to suggest abnormality of the olfactory nerve, it is then tested. I will now demonstrate the method of testing the olfactory nerve. Sarangi, can you close your eyes please? And can you occlude one nostril? Can you feel odor?
Yes.
Can you identify it?
It's peppermint.
Good. Can you close your eyes again? Occlude the other nostril. Can you feel this odor?
Yes.
Can you identify the odor?
No, I can't.
Right. So it is not important to identify the odor, but the patient should be able to identify a difference between the two odors. When testing for smell, do not use irritants such as ammonia, since it can stimulate the trigeminal nerve. Examination of the optic nerve consists of 4 components: examination of the visual acuity, examination of visual fields, examination of color vision, and examination of the optic fundi. In examination of the visual acuity, it is done by asking the patient to read the smallest line on a Snellen's chart while standing 6 meters away. At the bedside, pocket Snellen charts may be used. In doing so, it has to be held 2 meters away from the patient, and the patient is asked to read the smallest line possible. If the patient has difficulty of vision, one needs to exclude refractory error by asking the patient to read through a pinhole. This is the pocket Snellen chart. The Jaggers chart is a chart that is used to examine the patient's near vision, and this is held 30 centimeters away, and the patient is asked to read the smallest print possible. Would you like to read this?
If children live with criticism, they learn to condemn. If children live with hostility, they learn to fight.
That's good. Thank you. Examination of color vision is not routinely done in the neurological examination. When indicated, it should be done using the Ishihara charts. Visual field testing is most accurately done by perimetry. At the VIII, it is done by the confrontation technique. In the confrontation technique, one uses a white hat pin to map out the visual fields. The examiner must sit opposite the patient. It is important to be at the patient's eye level. Sarangi, can you close your right eye please? And the examiner must always maintain a constant distance. You can see this white hat pin.
Yes.
Right. Now close your right eye. With your left eye, look at my right eye. Do not look elsewhere. When you see the white ball, just tell me that you can see it.
Can see. Can see.
Look at my eye.
Can see. Can see.
Right. Now we will examine the other eye. Sarangi, close your left eye please. Right. With your right eye, keep looking at my eye and nowhere else. Tell me when you can see the white hat pin when it comes into your visual fields. Do you see it now?
Can see. Can see.
Keep looking at my eye.
Can see. Can see.
Good, thank you. The white hat pin is brought in from 4 directions. For examination of central field defects, or what we call scotomas, we use the red hat pin. And in doing so, it is the same technique. Sarangi, can you close your right eye, please? Maintaining same distance, and one will try to map out the red, with the red hat pin, any visual field defects in the central field. Examination of the optic fundi is done using the ophthalmoscope. The ophthalmoscope is held in the hand so that the index finger is able to adjust the dial. In examining the right eye, the examiner stands to the right of the patient, and it is important to clearly instruct the patient. Sarangi, I am now going to examine your eye. I will flash a little light into your eye, and I want you to focus at that distal object. Do not move your eyes, keep looking at that object. Do not look at this light. You may blink your eyes if you want to. When examining the patient's right eye, it is important to use the examiner's right eye and hold the ophthalmoscope in the right hand while standing to the right of the patient. In examining the left eye, the examiner must stand on the left side of the patient, hold the ophthalmoscope in his left hand and examine using his left eye. Sarangi, look at that object. The third, fourth and sixth nerves are examined together. The first step is to inspect the patient's eyes for the presence of ptosis, proptosis and squint. One must note the size, shape and symmetry of the pupils. Examination of the ocular movements. The patient's head must be steadied. Sarangi, I want you to follow this object without turning your head. Move your eyes to look at the object and tell me if you see double. Do you see double?
No.
Now?
No.
Now?
No.
It is important to move the object at a level above the patient's eye level so that the pupils and the eyes can be clearly observed with the eyes widely open. Although nystagmus is due to dysfunction of the vestibular component of the 8th cranial nerve, it is tested during testing eye movements. In doing so, it is important to realize that nystagmus beyond 30 degrees at the extremes could be normal. Therefore, nystagmus is noted at a point just at 30 degrees of the straight vision. And it is also important to note that nystagmus, there is a fast phase and a slow phase, and conventionally it is the fast phase that is given as the direction of the nystagmus. Examination of the third cranial nerve is not complete without examining the pupillary reflexes. These include the light reflex and the accommodation convergence reflex. The light reflex is best done in a room where the ambient light is low. The source of light from the torch should be brought onto the patient's eye from a side. The patient is asked to focus at an object in the distance. Sarangi, can you look at that distant object? Don't look at the light. The source of light is then brought from a side, and as the light is flashed onto the eye, one must note for the direct pupillary reflex and also the consensual reflex on the opposite eye. The opposite eye is tested in the same manner. The source of light is brought from the side, and both the direct and indirect light reflex is noted. The accommodation convergent reflex is done by asking the patient to first focus at a distant object. Sarangi, can you look at that distal object? While the examiner notes the size of the pupils. The patient is then asked to focus at the tip of the nose while holding the eyelids elevated so that the pupillary size can be noted. The pupils should constrict when the eyes converge in a normal person. Testing the fifth cranial nerve constitutes three components: the sensory, the motor component, and the reflexes. When testing sensation, one needs to test for pain, light touch, and temperature where relevant. Pain is tested using a toothpick and not a pin. It is important to map out the dermatomes as well as to compare both sides. Sarangi, close your eyes. Say yes when you feel the sensation. Do you feel?
Yes.
Say yes when you feel.
Yes. 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 Yes.
Is there any difference between the two sides?
No.
The sensation of light touch is tested using cotton wool in the same technique that was demonstrated. Close your eyes again.
Yes. Yes.
Is there a difference?
No. Yes. 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 Yes.
Is there any difference between both sides? Where relevant, temperature can be tested using tubes filled with either ice water and warm water using the same techniques. Close your eyes and tell me whether you feel warmth or cold.
Cold. Cold. Cold. Cold. Cold. Cold.
Is there any difference between both sides?
No.
The sensation of cold and warmth can be alternated using two tubes, one with cold water and one with warm water. The motor component of the fifth cranial nerve is tested first by observing for any wasting of the temporalis muscles. Thereafter, each muscle is felt for. Sarangi, clench your jaw. Feel the temporalis muscle and then the masseter muscles. Thereafter, the patient is asked to open her jaw against resistance. Say ah, Sarang.
Ah.
Right. If the jaw deviates to one side, that is the side of pterygoid muscle weakness. The reflexes of the fifth cranial nerve includes the corneal reflex and the jaw jerk. The corneal reflex is done using a fresh bead of cotton wool. It is made into a cotton wisp. The patient is asked to look upwards and outwards. while the wisp of cotton wool is touched on the edge of the cornea. And the other eye is examined in the same manner. It is important to touch the cornea and not the sclera, and also it is very important to ask the patient whether she felt the sensation of cotton wool. Did you feel this cotton wool touching your eye?
Yes.
Is there a difference between the two sides?
No.
The other reflex is the jaw jerk. This is done by asking the patient to close her eyes, half open her mouth and relax the jaw. Sarangi, close your eyes, half open your mouth, little bit more, relax. And one must tap, the examiner taps his finger vertically downwards and observe the masseter for a contraction. We start examining the facial nerve by observing the patient for any facial asymmetry. One must note for any impaired blinking, symmetry of the nasolabial furrows and general symmetry of the face. Thereafter, we ask the patient to perform certain actions so that we can test individual muscles. Sarangi, wrinkle your forehead. That's good. That tests the frontalis muscle. Close your eyes tightly and don't allow me to open them. This tests the orbicularis oculi. Blow your mouth now. This is to test the buccinator muscles. Say E, and that is the orbicularis oris, and also one can notice the symmetry of the nasolabial furrows. Now show me your below teeth. That shows the platysma muscle. The cochlear component of the eighth cranial nerve is tested by whispering into the patient's one ear while masking the other ear by rubbing the external auditory meatus and asking the patient to repeat what the examiner whispers.
25. 52.
It is important to be out of the patient's visual fields, otherwise she can lip read and tell what the examiner is saying. Once deafness is noted, it needs to be differentiated whether it's conductive deafness or perceptive deafness. This is done by using a tuning fork which is 256 Hertz. And there are two tests that we do. One is the Weber's test and the other the Rein's test. The Weber's test is done by keeping the tuning fork on the patient's vertex. Can you hear in both ears?
Yes.
Is there any difference?
No.
The Rein's test is done by first keeping the tuning fork over the mastoid process. Tell me when you can't hear the vibration.
I can't.
Now can you hear?
Yes.
The Rein's test is done in that manner to see whether there is conductive deafness. The 9th and the 10th cranial nerve are tested together. Ask the patient to open the mouth and say ah while noting for any asymmetry of the palate and looking for any deviation of the uvula. Sarangi, open your mouth. Open well. Say ah.
Ah.
Say ah again.
Ah.
Note any asymmetry of the palate and deviation of the uvula. The accessory nerve is tested by testing the patient's sternocleidomastoid and the trapezius. The sternocleidomastoid is tested by asking the patient to turn her head against resistance while feeling the sternocleidomastoid. Sarangi, turn your head. And one must feel the bulk and the strength of the sternocleidomastoid. Similarly, the opposite side is tested in the same manner. The trapeziae are tested by asking the patient to shrug her shoulders while the examiner tries to push it down. Shrug your shoulders again. That's good. The hypoglossal nerve supplies the tongue muscles. The hypoglossal nerve is therefore tested by examining the tongue. The tongue must first be examined while it is within the oral cavity to note for any fasciculations or wasting. Sarangi, open your mouth. While the tongue is in the floor of the mouth, the examiner must observe for any fasciculations or atrophy. Thereafter, the patient is asked to protrude the tongue. Sarangi, protrude your tongue. And one must note for any deviation of the tongue. Thereafter, the patient is asked to move the tongue in all directions. And one must note for any spasticity or limitation of movement. Thank you. Examination of the cranial nerves form a vital component of the examination of the nervous system, since it provides important localizing signs